Hi guys, today we'll be discussing hypoglycemia. We'll be looking at its definition, its signs and symptoms, its causes, the dangers of hypoglycemia, and its prevention. Now, the world has been so concerned about hyperglycemia that people go about being concerned or careful of what they eat and how they exercise in order to keep their blood sugar under check, forgetting its broader hypoglycemia, which can also be dangerous. Now, what is hypoglycemia? Hypoglycemia is a disease condition that occurs as a result of low blood sugar or low blood glucose. Now, a fasting blood sugar that is below 70 mg per dl is taken to be hypoglycemia, and one that has 54 mg per dl and below should be taken to the hospital for immediate medical attention. Hypoglycemia can be caused by long starvation, medications, hormonal imbalance, and excessive alcohol intake. Now, what are the signs and symptoms of hypoglycemia? One who has hypoglycemia can witness or experience shakiness of the body, tingling of the hands, dizziness, weakness, lightheadedness, dehydration, paleness, hunger, and so on. What are the dangers of hypoglycemia? When there are repeated episodes of hypoglycemia, it leads to what we call hypoglycemia unawareness, in the sense that the body and brain stops producing signs and symptoms of hypoglycemia, making the person unaware that he or she is hypoglycemic. And when this happens, the risk can be severe or life-threatening. Now, people that are at risk of hypoglycemia first are diabetic patients. Now, diabetic patients are known to be so conscious of their blood sugar level, and that is why we usually advise diabetic patients not to feast or fast. When a diabetic patient fasts, the person's food intake reduces, making the insulin, which is the drugs, to break down sugar more than it should. And when the body uses this sugar as energy, it is left with nothing to work with and can lead to hypoglycemia. Secondly, weight management patients. Most times, weight management patients tend to avoid food in order not to gain weight, at the same time depriving their body what it needs to work, and as well predisposing themselves to hypoglycemia. Thirdly, strenuous workers. People who engage in hard labors or strenuous work tend to burn more calories, and this can predispose them to hypoglycemia. Finally, the clergy. When the clergy engages in spiritual exercises like fasting all the time, this can predispose them as well to hypoglycemia. Now, what are the complications of hypoglycemia? Untreated hypoglycemia can lead to seizures, coma, falls, injuries, motor vehicle accidents, and even death. The preventive measures for hypoglycemia: avoid skipping your meals, especially the breakfast. Avoid fasting as a diabetic patient. Avoid starving. And finally, snack in between meals with fruits and vegetables. Finally, in as much as you want to be in or maintain attractive body shape, also remember that you need to eat adequately to supply the body with the nutrients it needs for metabolism and to run the daily activities. Please eat adequately, because hypoglycemia as well can be life-threatening. Kindly drop your questions in the comment section, and I'll see you in the next video. Thank you.